Our guest today is Dr. Khalid Hannouneh, and we're talking about prophylaxis.
There is 10 billion bacteria in your mouth that lives in your mouth normally. We're talking about 43% of the population.
So that's an important thing to understand.
Exactly.
Is only dental related?
Early onsets or Alzheimer, is related directly to the oral bacteria.
Wow. I feel like now I want to go and wash my teeth.
And from there came my idea, massage to the gum. That's a mouth spa.
The patients are coming back, and that's a good thing.
We get them a metal implant, metal screw in their mouth, they become Iron Man.
There's a trend of the wellness.
Okay. Dubai was always a place for what people called crazy ideas.
No implants anymore.
Let's work for you.
The good, the beautiful
and the truth.
Welcome to NextDental, where we talk about what's changing and what's next.
Antonello Croce, dental technician and digital dentistry consultant, founder and CEO of Remedico, inventor and ambassador of digital flow in dentistry.
Our guest today is Dr. Khalid Hannouneh.
Dr. Khalid Hannouneh, a leading cosmetic and laser dentist in Dubai, founder of GBT Clinic by Dr. Khalid, the world's first mouth spa. His clinic follows a prophylaxis-first approach, using pain-free approach to promote oral and overall health in a spa-like setting.
And we're talking about prophylaxis, something that might sound familiar, but it is not, because we'll see it from a different point of view. Good morning. How are you, Khalid?
Good morning, Habibi. I'm fine. How are you?
Good.
Good to talk to you, Antonello.
Good to see you today.
Thank you.
I would like to ask you, why did you choose to build your practice around prophylaxis, like something that other clinics might treat as a secondary, instead of you opened a clinic now around prevention? So why did you choose? Did you make this choose?
First of all, thank you for this chance. That's where we actually meet and talk about this. I think if I want to give you a reasonable answer, I have to build it on some information before. So, as you know, I have built my clinics already before on polyclinic or specialized dental clinics, where we have all specialties from cosmetic to orthodontics, pedodontics, and old surgery, even an implant. And we have done in Dubai, in the downtown Business Bay, and we even did one in Sharjah.
Sharjah as well.
Yes. In Sharjah is more of a big medical center where we have other specialties, and we started adding things to this, because like lasers and stuff. There was a major, let's say, transformation point. Now, my background, when I came here, before I started even getting my license and working in the clinic, I started working with companies, dental companies, for marketing and sales of dental materials. And during this period, I had an interaction with different companies, different types of technologies. So I was training for the Painless Dentistry, STA, nitrous oxide, and I was involved in something called Painless Dentistry. So I read more about Painless Dentistry, and I found out painless. Not pain-free. Yeah. Remember, there is two concepts. If we want to talk science, we cannot say pain-free, because when we say pain-free, we are giving a promise of 100%. And as you know, as scientists, we cannot say 100%. There is no such thing as 100%. So we always keep a small chance. So painless dentistry was revolving around providing, it's like a myth. It was like a dream. It's the nirvana of dentistry, if you want to call it. And there are many protocols in dentistry, equipments, tools, and machines that provide painless treatments from computer
painless.
anesthesia.
I like this word. And
exactly.
you also like
exactly. And while I was studying this, I found out that there is something called odontophobia.
Okay. Yes.
The fear of dentists or dental treatments, and
I don't have it. But
imagine it's the fourth most common phobia that people as a population. We're talking about 43% of the population in general like we are 8 million, so you're talking about 3.7 million, we are like 8 billion, 3.7 billion people would experience the odontophobia in different levels. So we're talking about odontophobia where it starts from just fear of going to dentist, and it reaches up to a phobia level where you technically cannot control your reactions.
Yeah. What it's most for the younger people or for all the?
It's for both.
For both.
For younger people, it's just for them a new experience, as we know, fear of something new. But of course, communication with them will play a big role. So if you handle them when they are young properly, the dentist treats them properly, and you give them time. We have the something of tell, show, do for the kids. So you have to tell them, then show them what is this, and then you start doing. It's preparation. And remember, the trauma that we cause for the kid at this age will eventually reflect on them for the rest of their life. So you have a lot of people now, adults, they come to my clinic with phobia. It means that the patient starts shaking on the chair before we start doing anything. And they don't remember, but if you go back and dig deeper, and I tell them to ask their parents, did they ever have a bad dental treatment when they were kids? They don't remember it, but yes, most of them they had, where it was traumatizing experience, which resulted eventually to them developing this phobia that they avoid dentist, what leads to bad dental situation.
But what are, you mentioned that the patients that come to your clinic, you also have other clinics.
Yes, we have other special.
This one is focused, has the prevention at the center.
Yes, exactly.
Like you also call it mouth spa.
Mouth spa, yeah.
It's an interesting word because the idea behind it, it's bigger.
You know, the idea of coming to a dental clinic is not a pleasant thing. Neither for you nor for me. Now it's my work and stuff, but even for me, it was always, even me being a dentist and having my dental checkups or dental clinics or even dental treatments was kind of something not very comfortable for me, but of course not reaching the phobia level. Now, understanding the importance or the impact of this fear of the dentist on the patients as comfort, as follow-up, as even if you're talking about the business of a dental clinic, this is something like the most canceled or no-show to appointments is a dental appointment. This is a statistic. So you ladies will not miss their hairdresser or nail, but they would miss their dentist,
don't
you know?
Show up?
So the idea was to find a way to break it. When I understood this concept of odontophobia and dental, so I started looking for ways to do it. Now, fast forward, this was in 2013, 2014. Fast forward in 2017, I had an interaction with a big manufacturer, like the most prestigious one in the dental field, called it's EMS, you know, a Swiss company that produces these hygienic systems, prophylaxis systems. And they have just invented, in collaboration with the Swiss Dental Academy, a new concept in dentistry called the GBT, or the guided biofilm therapy. And it was interesting for me. So they have this machine. I brought this machine to my clinic, and we started using it, providing the dental prophylaxis treatments according to the GBT standards, which is a protocol for teeth cleaning. And we managed to provide this dental cleaning painlessly. Painlessly, very advanced, because you can see, you can, as a dentist, you can see the biofilm, which is a layer of bacteria that forms on the teeth and causes damage to the gums, to the teeth, and eventually it goes through your gums, to your bloodstream, to your body, causing this ongoing inflammation in your body. So you might have a chronic inflammation in your gum for 2 years. And this means like you have an open wound for 2 years that has bacteria entering. Imagine what it does to your heart, to your brain, to your lungs, to everywhere. So it slowly destroys it. We managed to have this GBT, and the patients were really happy about the procedure. And we've noticed that people were coming back more frequently. So before, with the normal dental clinic, people were even still, it was painful for them. So they would do it every 6 months if they come back. We called them, remind them. We found out with the GBT, people were coming back.
More often.
They were committing
Always.
more. Yes, exactly.
Yes.
And they were happy with the procedure.
Yeah. So the machine is something that the patient doesn't understand. I mean, so me as a patient, I'm coming to your clinic because I see different approach of it. Like it's mostly as a prevention. What do you feel that the patient when comes, what they are expecting from the clinic, why they are coming. They might come because of different idea. I mean, they might know that it's not a traditional cleaning or a traditional. So because I imagine that the response to this approach is good. I mean, as you mentioned, the patients are coming back, and that's a good thing. So they are expecting something different that was not out there.
Yes. So let's understand, why is the patient coming back?
Yeah.
Why does the patient, what is the fear of the patient? First of all, the pain. So patient is afraid of the pain. When they have this experience of GBT for the first time, they understand that it is super nice. Some of them even say that they didn't feel the powder on their gums, that they felt only like a massage of the gum. And from there came my idea, massage to the gum. That's a mouth spa.
Yeah, okay.
You know? In the beginning, I called it oral spa, but it sounds wrong. So we changed it into a mouth spa, you know? And from there, we understand. So first, pain is eliminated. Second, education in dentistry.
Yes.
Let's be honest. As dentists, we have a duty not only to treat patients, we have to heal patients.
Yeah.
And we've been for a while only drilling and filling. Caries, drill the caries, put a filling, and let go. Extraction, remove the tooth, let go. It's all mechanical. Of course, we are doctors, we are healers. So we have to come back to the roots. Our job is to heal things. And with GBT, I found out that we're healing people. We're healing them not only in their gums and teeth. We're healing them and protecting them from more serious medical issues in the future that is related directly to their mouth. Imagine now statistics and studies, and it's becoming more clear, and you will see in the next 5 to 10 years, it will be a main concentration where they will start preventing or treating some general systemic diseases from the mouth. So this biofilm has as a main impact. So when the patient was coming, having painless treatment, at the same time, we are educating them. As dentists, our responsibility is to educate our patients. Our patients, they don't get, we as people, we don't get the awareness of our oral hygiene from the school or from the street or even from the TV. It's not an interesting topic. It's a topic everyone tries to avoid. So the patients, when he or she come to my clinic, for me to educate them, to give them an idea, and they never knew, because many of us as dentists didn't know that the biofilm has this impact, because now science is showing more. So understanding that this is an important thing to keep you well. You go to the gym, you wake up in the morning, you do your morning routine, you eat healthy, you train, you sleep well, but then there is an issue. You're trying to live longer and healthier, and this is amazing. And this is a trend now. People want to live a healthy life, and after COVID mainly, people started taking more care of their health, because they understood that this is the most precious thing you have. So in order to maintain this wellness, you have to eat healthy, train, and be psychologically healthy, whatever. Main factor is your oral wellness, because it will reflect on your general wellness. That's what trying to people understand.
Yeah, exactly. And sorry to interrupt, but taking this point, like if we educating the patient from the beginning, from before, because now we're treating a patient, maybe they already have some problem. So if we start educating them from the beginning, let's say in the future, so what are we? We're doing something good, and so what benefit are we having with this prevention? Is it only dental related?
No.
Or more?
Okay, thank you very much for this question, because we call it the $1 million question. You know? I'm gonna talk about an experience, the Dubai experience, the UAE experience. Some people might feel or think that I'm a biased. Yes, I am, because I don't think there's someone who can compete with what's happening in UAE. Yeah. We started, remember, in the 80s and 90s, it was the American dream. Now I call it the UAE dream or the Dubai dream. It's a place where that's why people are leaving their countries. There's a big wave of people moving, because in this place, they care about people. They care about people wellness, about people life, or people happiness. There is a Ministry of Happiness in UAE. Wow. Part of this policy, and here, listen, I'm not really I'm not here complimenting, I'm talking facts. So if you look at facts, something nobody knows because it's something new. The Ministry of Health in the United Arab Emirates is the first ministry in the world that is technically adopting GBT as a standard protocol soon. Standard protocol for the dental hygiene. Why is that? Why would a government invest in such concept? Because they understood the idea of the importance of the oral wellness on the general wellness. And this, it's not only buying machines and using this protocol, it's also about educating their patients. So now it's a main responsibility of us as dentists to educate, but also the governments and what we call it, the NGOs, to technically start educating people about the importance of the oral care. So there are public health awareness campaigns that highlights the importance of oral health on general health. When you are having a better oral wellness and better health, oral health, you will have less problems.
Exactly.
And this costs the governments and the insurance companies.
Yes.
When you have more problems, you have more spending on this. It's not spending, it's a waste. This is a waste when you have more problems, more implants, more the cost, the time, the effort, even the health of the patient. So now they understood the idea since a while, of course, but the importance of prevention. To avoid these problems. So it's an investment in the future, like they always do, you know?
Yeah.
And I see this brilliant, honestly speaking, and I believe this will be, I hope, this will be an experience to highlight. And from there, I hope you will ask me the next question about why UAE for GBT clinic, for example. I have an answer. Ask me. You know.
Okay, I have a question to answer.
No, because I don't want to jump to the next part. You know, like
So okay, why is this? Why choosing GBT?
GBT clinic. So we go back to your first question that I didn't answer. I was talking about other stuff. Why GBT? I wanted to build this idea to reach here.
Yeah.
GBT as a concept is a Swiss concept, you know, by the Swiss Dental Academy. Now it's an international concept. Yes. And it is applied in many clinics around the world where the machine is there, the dentist, the hygienist, or whoever dental practitioner is there getting special training to be certified to use this protocol by the Swiss Dental Academy. So the clinic is called Certified Dental Clinic, GBT certified. And I am a KOL trainer for this in the Middle East, in UAE, in Saudi, Qatar, around the place. You know, even in India, we did some courses. So technically, we're spreading this knowledge. Now, why to open a clinic that's dedicated for GBT? Yes. First of all,
when you say GBT, I also want to mention that
it's biofilm therapy.
Yes, but it's dedicated
for
to prevention.
Yes, to prevention.
So that's an important thing to understand.
Exactly. Yes. Now, any treatment you do, a lot of people do implants now.
Exactly.
The question, how do you maintain this implant? Unfortunately, the patient thinks that when we get them a metal implant, metal screw in their mouth, they become Iron Man. Like they don't have decays, they don't have problems, which is wrong. Because your effort that you do to maintain this implant will be much bigger than maintaining your normal tooth. So people who lose their teeth from periodontal issue because of their negligence, I don't do implants for them because they will lose for sure the implant. So technically we educate, we do awareness, and then we start to do maintenance. The most efficient and let's say comfortable and clinically proven, supported with more than 4,000 studies, imagine, is dental implants, dental implants cleaning done by GBT. So this clinic is there to provide a better experience for the patients. I mean, you can see the clinic. You saw the clinic. Technically, it looks more like a spa where we give a feeling of the patient. We improve his psychological experience of entering dental clinic. So patients, they enter, they don't know if they're in a dental clinic or in a gallery or in a spa. They don't know. But it doesn't show anything that they are in dental clinic because we want to break this dental experience. We have a special people that take care of them. We call them special names that technically changes this idea. Even the dental rooms are not called dental room 1, dental room 2. It's called, according to cities, Geneva room.
Oh, that's nice.
We have Interlaken retreat. We have, technically, we're changing this experience. So when I tell the patient, when I tell my assistant, take her to Geneva, patients, you know, the experience starts different. So we work on the psychological part. And again, we are dedicating it to provide this painless, comfortable, highly preventive, and special dental experience for them to clean their teeth, remove their biofilm, make them feel good, and they come more often. You know, so technically it's dedicated. Now, why Dubai? Of course, I always believed. So I had a suggestion and options actually to open other places, maybe in Europe. Dubai is the place to start these things.
Yeah.
Dubai was always a place for what people called crazy ideas.
Yes.
And then we knew that it wasn't crazy. It was a dream, ambition that's beyond anyone's expectation. And then it becomes reality. So in Dubai, it's a place where you can come up with these ideas, apply it, and explain it to people, apply it properly. And you will see people how it starts from Dubai. So GBT Clinic is not only in Dubai, there is now in Lisbon.
Yes.
There will be in Geneva, there will be in Sydney, there will be around the world. But we are proud to say that in the future, that it started from here. Of course, Swiss concept, but even the Swiss Dental Academy supported that we started from here because, listen, whether they like it or not, Dubai is the place to be because it's the center of now.
It's something even deeper because I imagine that you say Dubai because because maybe the people who are living here are taking care of themselves more they understand this concept maybe because they are youngest compared to they are younger, and also they like taking care as a trend of the wellness. They go running every day. They like taking care also of the dental or cavity.
There are many factors here. We have to first of all, of course, we have to understand in this country you have a young population.
Yes.
So people who come to work here are mainly people at the working age between, let's say, 20 to 50, 60 even. Now, young age is extending to 60. I don't see someone who's 60 or 65 as an old person, you know, because level of life is improving. And in this country, we're talking about big population who are expats coming here to work at the young age where they can give and they can produce. So when we have these people at this age here, they are also taking care of their health in terms of wellness, in terms of trying to go to the gym, keeps this healthness, in addition to having a general idea of the whole country, which was built by the founder of this city, Sheikh Mohammed bin Rashid, in terms of always wanting to be number one in everything and always wanting to improve and always wanting to be special and apply the latest technology. Yeah. This behavior reflected, I think, on everyone who lives in this place, reflected on me personally to be a dreamer, reflected on you to be a dreamer and chase your dream, leave Italy and chase your dream in Dubai. Yeah. Because for us, it's a place where it supports this ideas and this behavior. So people, when they come here, it's more of they wanna do new things, they wanna start new businesses, they wanna create the special ideas. That's why you see a lot of crazy and beautiful and amazing innovative ideas starting from here. Everything is on a different standard that is pushing everyone to bring the best out of them. That's why you see people achieving their Dubai dream here.
Yes. So wellness here is at first.
Yes, wellness is first because you have to be healthy all the time to be able to continue and to produce. Because if this is not good,
yes, exactly,
this is never good.
Exactly. So, but I am a dental technician.
Yeah.
If we do more prevention in here, let's say in 10 years, there will be. Let's just imagine.
Yes.
More prevention.
Yes.
But
less
no implants anymore.
Less work for you.
Do you think this will ever happen?
Listen, this is a dilemma. I've been discussing it with my colleagues. There will always be things. So when we work prevention of pathological dental issues that is related to biofilm and bacteria. Caries, root canals, implants, but it doesn't mean that there will be no everyone that will be like this. There will always be something. And moreover, we will concentrate more on the preventive medicine, that we will do other form of treatments into prevention. I don't know what it could be, but there will be more prevention technologies. But what it will eventually lead to, yes, maybe less patient in terms of severe dental pathologically related treatments, but at the same time you'll always have traumas. You'll always have broken teeth. You'll always have people with decays. You'll always have this. So it doesn't reduce. I see it improving people's lives. So there will be more mouth spas, and less scary dental clinics, with aggressive procedures. And I see it. I don't want to be idealist, but and a hypocrite. Of course, I don't want to have less work, but I want to have more work in the thing that makes me feel good.
Yes.
Where I'm healing people. Now we see it in dentistry. There are a lot of biocompatible material and biomimetics material. So now we have new fillings that technically claims that it restores the dentine, so hydroxyapatites and stuff. So we are going into the healing, and this is the future. If we try to stop this, if we try to fight this, we will stay behind. So I think it's a train, and it's moving, and we cannot stop it.
No, never.
So we cannot stop it, and we don't need to, because we have an ethical responsibility as well to support anything that improves our patients' health and the public health, because these patients are my mom, my brother, my father, my wife, my kids, So whatever you want to apply, what you want a doctor or dentist to apply to them, you have to apply it to all your clients, because they're not clients at the same day. They are your people who trusted you. So we always aim and try to provide the best. We are not the best, but we always try to be the best.
But so connecting this point, like more prevention, less issues, the outcome is good.
Yes.
It's good for the patient.
For the public.
Do you think that we as a profession, like all the companies and then these professionals related, are doing enough to connect these dots, or is it just something that maybe is starting now?
Yes. So I believe in dentistry, the problem for us was always time.
Yeah.
We dentists don't have time. We have schedule that's booked. I don't know how many, 10, 15, 20. Some people, they tell me numbers of seeing 30 patients a day and 50 patients. That's for orthodontists, because, you go, so they do 40 or 50 a day. We have tight schedule. We don't have time. We don't have time for our patients. We don't have time for our family in the first place, because we have to give our time for our patients. And then we come to the clinic, we don't have time for our patients. So we spend our life running in these vicious circles. And we are, as dentists, the only or one of the very few doctors that we do operation for every single patient. Yes. I mean, other specialties, you do consultation, but technically we do an operation, because once you do, whether it's a cleaning or a filling or an extraction or a period treatment, it's a surgery. So every time the patient comes, you are doing cutting in healthy tissue, which is rated as surgery. The idea is we don't have time. This is giving us stress. So we don't really, we lose track over years.
Yeah.
And we lose attention to ourselves, to why we studied this, to why we have to do this, and to eventually we forget to listen to our patients, to see what they want really and how we can really improve their experience. I try as much as I can to not lose this. Over years, when you grow in your work or in your business, you start feeling that, oh, wait, I am losing this. Like life or this career is swallowing me. And technically, I don't want this to happen. So I put brakes and I go back. I let some steps back. Okay, listen, less patients today, please. I want to have more patience with each patient. I want to have this human relation where I listen to the patient genuinely. I don't hear the patient. I listen to the patient and give them what they really need. And if they don't know what they want, to guide them to what they actually need for their mouth health. And now I say general health. So GBT Clinic by Dr. Khalid in the JBR is not a center for prophylaxis. It's a center for mouth and general wellness, where we provide this with the most comfort and the least pain possible, with the highest health outcome possible.
The good, the beautiful
and the truth. Exactly, that's amazing. And this is for Platon,
No. What?
Yeah, it's from Platon, from Greece, it's his concept about the truth.
Yeah.
It's technically, he says that the truth should be good, should be beautiful, and should be true.
It should be true.
So,
Yeah.
so this is the GBT,
This is interesting innovation. And if we think of what has been done here, there is a new tech, of course, but the tech is the last, it's important.
A lot of tech. I mean, this machine has 13 patents,
Yes, yes,
Lots of
exactly.
tech.
But there is behind this also something that it's bigger, like taking something that was out there, was treating as a secondary, and build it as an innovation, like make it at the center, make it with the new technology. But the prevention has always been out there, but not treated maybe as we should treat the prevention. As Dr. Khalid is now recommending how to do it. Okay, interesting innovation that we've heard today. And to let you understand better, let's see together. If we remove all the biofilm, all the problem with doing this therapy constantly, does this mean that we will not have any problem anymore?
So let's divide the answer into options, dentally and generally.
Okay.
General health and dental health. There is a study done by two major doctors. My colleague dentists will know their names, Professor Linde and Axelson. These guys, they are the authors of most of the books we study in university about periodontology. These two, or gum health. These two, they have done one of the clinical researches, one of the longest clinical researches in the field of medicine and dentistry. They did a clinical study with 30 years follow-up. 30. They started the study in 1974 and they finished it in 2004. 30 years. They were having their patients coming for dental cleaning, where they were controlling the biofilm, doing disclosing for the patients, removing teaching the patient how to brush properly, because it's a big part of the awareness. Patient health at home, what they do at home, it's 50% of what we do. Yeah. So they were teaching their patients how to clean, and they were removing the biofilm completely. And they were doing this for them regularly for 30 years. The conclusion was, when they controlled the biofilm, there were no more caries.
Wow.
And no attachment loss. Now, there are studies. I mean, you can see the studies are there, the references. You can even provide whoever wants details about this episode and they want details about the study, I can provide you the resources, the source of these studies actually. And technically, it was the mouth nirvana.
Yeah.
So controlling biofilm resulted in no more caries and no attachment loss. This was done on around 257 patients. Now, does this mean that we will eliminate this? I can tell you no, but we can reduce it to the percentage of 99 point something or 98 even if reduce it to 90%. You are improving the lifespan of your teeth and gum, and 90% of you do that. If we will debate about 100%, then I'll tell you, yes, you win, but you lose the other 90%. Now, this is dental part. General health part, I have a friend of mine, a very amazing dentist in London. Her name is Victoria Sampson. I say hi to her, maybe if she sees this. She's done a podcast and it went really viral. A very interesting thing she was talking about, which is they found out that early onsets or Alzheimer, is related directly to the oral bacteria. So technically controlling this oral biofilm is resulting in either delaying or even not onset. I don't have the exact details of the study, to be honest with you, but it is there. I also can share it with you. I don't have it in my mind now. But we know now that this is reflecting on a lot of things. You're technically avoiding a lot of problems, and science is showing us a direct link now between this oral biofilm and a lot of things. When we say Alzheimer's, when we say lung cancers, when we say, even, in COVID, there has been a study that said they did it on around 97 patients over 6 months. Those patients who had oral infection were 9 times more susceptible to death of COVID than those who didn't have oral infections.
Wow, that's interesting.
So let's simplify it. Take care of your mouth, of your teeth, of your gums. because it is directly related to your general problems. You might have other problems in other places of your body that you do not understand, and you're treating the wrong thing. Go treat the cause, the source. And remember this example. If you cut your hand and you have bleeding, the first thing to do is to wash it, clean it, disinfect it with alcohol, and cover it so it doesn't get infected. Imagine every time you brush your teeth and you see blood coming from the gum, it doesn't bleed now. It's open wound all the time. You just sew it because you were brushing with a hard toothbrush. But this wound is open all the time. And there is 10 billion bacteria in your mouth that lives in your mouth normally. We call it the microbiome. That is technically going through the bloodstream, going to different organs in your body and causing inflammation. And this bacteria is running in your mouth for years sometimes. People come to me, tell me I want to do whitening, and I test their gum. They are flappy gum with the 8 millimeters pockets. So again, if you keep on treating your dentist like in a consumer way, where technically you are going to buy what you want, not what you need, that's a problem. That's why please go to your dentist appointment every 4 or 6 months. Because once you feel something, it might be already too late, and the treatment is more complicated if you go preventive visits.
Wow. I feel like now I want to go and wash my teeth. Okay. So it's important to take care also of your oral cavity. If you are taking care of your body, you are going running, let's go and take more care about your oral cavity.
And you will have less work later in the future if they do this.
Thank you, Dr. Khalid, for coming today and for your knowledge.
Thank you. Amazing interview. Thank you very much.
See you next time.
Want to use AI in your clinic? Try Remedico EMR, sponsor of this episode. They are pioneering AI for dental clinics. Go to remedico.app and request a free demo now. Remedico, software for modern dental clinics powered by AI. Hey, and don't miss next episode. Search NextDental one word, no spaces on all major podcast platforms, and click subscribe.